And some may say we are in an opioid crisis, and we've got alternatives to help you get rid of the pain-free drug. We'll tell you about that coming up. Opioid addiction is a growing epidemic in the U.S., and when going to seek medical treatment, there may be a way you can opt out of using opioids to treat pain. Dr. Andrew Jordan and Mia Fields-Thornton believe that chiropractic care is a great alternative to opioid medications. And they join us now to tell us more about that. We'll begin with you, doctor, because I'm sure there are people that are watching right now that are saying, yeah, what are those alternatives and how can that help?
Well, chiropractic care is a great alternative. Opioids are most commonly prescribed to deal with pain, and back pain represents 1 out of every 4 opioid prescriptions written. So chiropractic care works to treat dysfunction in the spine, especially joint dysfunction. When you have irritation between how the joints are moving, it's going to affect the surrounding muscles, tendons, ligaments, everything. It's going to restrict range of motion. It's going to cause muscle spasm, give you all types of problems. So a chiropractic adjustment or manipulation is a great way to restore the normal mechanics of how the spine works, to actually treat the cause of the pain instead of using opioids to mask the pain.
My 94-year-old grandmother swears by the chiropractor. Like, she's gone there her whole life. But there are people that have never seen a chiropractor before. And why do people usually not go?
Well, we typically see people coming into the chiropractor because traditional medical routes have failed them. They've seen their primary doc, they've seen the orthopedic surgeon, they've seen whoever, and they're still having the same problems, whether it's in the gym or whether it's just trying to get through work. A lot of people come in from referrals because we have patients who, are running around shouting blessings about how great chiropractic works, and they convince their family or friends to come in. We also get direct referrals from medical people, medical doctors, as well as other surgeons, things like that. So there's a number of ways people come into chiropractic care, but the point is to try and get everyone feeling better and moving better.
All right, Mia, let's talk about how chiropractic care has been great for you.
Well, for me, I had a very traumatic childhood growing up here in the D.C., Maryland area, which unfortunately led me to an opioid overdose at a very young age. I was hospitalized for weeks, and then I decided to search for a more holistic form of medicine, at which I was introduced to chiropractic care at that time. When I met my husband, I had been receiving chiropractic care for years. So when we were introduced to the joint model, it was a no-brainer for us. We soon became owners in the North Carolina and Virginia markets, and now we are the regional developers for DC and Maryland as well.
Well, that's awesome. Congratulations. And how did it change your life? Obviously enough that you wanted to open your own business.
Yeah, so, the relationship between chiropractic care and your health in relation to the opioid epidemic, it just needs to be recognized. I am a hometown girl who has decided that I want to come back to my hometown to open businesses for others, to help others to take care of their health and wellness. I'm a living proof that chiropractic care can change your life. I'm a wife, a mom, and now an entrepreneur. And it's been a struggle for me, but chiropractic care has been my medicine.
That's huge. Okay, can we demonstrate some of the stretches that can help to aid pain that people may be able to try?
Absolutely, yeah. So I wanted to go over just a couple common stretches you can do at the office, at home, wherever, easy things to deal with back pain and neck pain as well. So Mia's going to be our beautiful model here. So the first thing we're going to do is a stretch for the front of the hip or the hip flexor. You can use a little towel under your knee if you have bad knees. Then if you pop down into a lunge position, step your front foot out a little bit forward in front of you. And you just want to keep your core nice and tight, and you want to lean your hips forward into the stretch. And so you should feel a really good stretch through the front of the thigh there. And you want to hold these stretches for at least a minute, if not longer, and doing them every day is very important as well. If you want to switch around the stretch a little bit, you can actually take your left hand and reach it over towards your left side, and that should add in a little extra bit of stretch there. And again, especially if you're sitting all day, this is a great way to open up your hips, which get really tight from being compressed like this all day long. Let me have you stand up for me. Another easy one you can do at home. It's just a little bit of repetitive extension for the low back. And again, when you're sitting all day, your low back tends to flex a whole lot. So all you need to do for this is put your thumbs in the small of your low back here, and you're going to gently use your thumbs to push your hips forward and lean back. I actually just felt a little release in my back. And you just do this back and forth. So just pushing all the way forward, kind of getting a little bit of extension right in the small of your low back, and back to neutral there. And so that's something that I would recommend doing for a couple sets of 10, say 3 sets of 10 if you've been sitting for a long period of time.
And like I've always thought, when I've gone to the chiropractor, you lay on the table, they do something to your back and you're like, oh, I feel better, like, or they line you up. But there's more than just that. It's not always just going and laying on the table.
Yeah, there's a lot that chiropractors can do, and there actually is a lot of overlap between chiropractors and other professions like physical therapists. So it depends on which office you go to, but the joint manipulation or the adjustment that you were talking about is what chiropractors are most known for. We can also do muscle stretches, muscle release. Depending on what state you're in, you can also do needling or acupuncture, and rehabilitative exercise, diet and nutrition. There's a lot that chiropractors can do to help you feel better that doesn't involve the use of drugs or surgery.
That's awesome. Where can people find out more information about you guys if they're interested?
You can visit the www.thejoint.com. We're also available on Instagram at The Joint Chiropractic.
Awesome. Thanks for coming in, guys.
Thank you so much.
Great
for
to
having
meet
us.
you. Thanks for all the great advice. We'll have more of Let's Talk Live coming up right after the break.